Meet two Americans, same doctor, same diagnosis, same drug, same dose, same pharmacy. One pays $25 a month, the other pays $1,400 a month. No, that's not a typo. And no, it's not because one person has better insurance or a higher income. It comes down to 4 digits buried inside a form your doctor fills out that most patients never even see. Today, we're pulling back the curtain on the one thing your doctor, your insurer, and your pharmacy are almost never going to explain to you. Unless you've been living off the grid, you've heard of drugs like Ozempic, Wegovy, Mounjaro, and Zepbound. Originally developed for type 2 diabetes, these GLP-1 medications have exploded in popularity because they also cause dramatic weight loss. We're talking 15 to 20% of body weight in clinical trials. They're genuinely the most talked about drug class in America right now. But here's the part nobody tells you when your doctor writes that prescription. Insurance coverage for these drugs depends almost entirely on 2 factors: your diagnosis and your plan type. Not how sick you are, not how much your doctor says you need it, not what your body mass index is. It's about which box gets checked on a form. And that one box can mean the difference between paying almost nothing and paying more than your rent. Here's how it works. When your doctor writes a prescription, they don't just write the drug name. They also attach what's called a diagnosis code, a standardized number that tells your insurance company why you need the drug. These codes determine whether your insurer covers the prescription at all and at what cost to you. Now here's where it gets wild. Take semaglutide. That's the active molecule in both Ozempic and Wegovy. Both are made by the same company, Novo Nordisk. The active ingredient is identical. It's literally the same drug. But Ozempic is FDA approved for type 2 diabetes. Wegovy is FDA approved for obesity and weight management. And because of that label difference, Ozempic is covered by roughly 85% of commercial insurance plans, while Wegovy, the exact same molecule, is covered by only about 45% of plans. Same drug, different box checked, completely different financial outcome. The same molecule is covered or denied based on the diagnosis code, not the patient's clinical need. Let me show you what this actually looks like on your wallet. Without insurance, Wegovy retails at $1,350 to $1,740 a month. That's not a typo either, nearly $20,000 a year for one medication. But the same medication that costs $1,349 a month without insurance can cost $0 to $25 a month with the right plan and a manufacturer's savings card. And here's the kicker. If your doctor writes the diabetes code instead of the obesity code, and you happen to have a diagnosis that supports it, your odds of commercial insurance coverage jump dramatically. That gap, between $25 and $1,400 a month, isn't about your health. It isn't about the drug. It's entirely about which 4-digit code appears on your paperwork. Now you might be thinking, okay, this sounds like a problem for people trying to lose weight, but this goes way beyond that. These medications are now being prescribed for heart disease risk reduction, sleep apnea, liver disease, and kidney disease. The population of Americans who could benefit from GLP-1s is enormous. As many as 48 million Americans who want to lose weight expect to start a GLP-1 drug in 2026 alone. And the coverage gap is hitting hardest in the places that need it most. States with the highest income burdens also have the highest obesity rates, notably Mississippi, West Virginia, and Louisiana, where rates top 40%. These are the communities where people can least afford $1,900 a month, and where access is most restricted. Okay, so what can you do about this right now? Number 1, ask your doctor directly about the diagnosis code. This is the conversation most patients never have. If you have both obesity and a related condition, prediabetes, high blood pressure, sleep apnea, high cholesterol, some doctors work around coverage restrictions by prescribing Ozempic off-label for weight loss in patients who also have insulin resistance or prediabetes. This is a legitimate clinical decision, but it depends on your doctor knowing to do it and you asking. Number 2, always appeal a denial. Roughly 40% of well-documented appeals succeed. If your insurance denies coverage, don't just accept it. Ask your doctor to submit a prior authorization with full documentation of your medical history. Number 3, check manufacturer programs. With commercial insurance plus a manufacturer savings card, any branded GLP-1 can come down to as low as $0 to $25 per month. These savings cards exist, but most pharmacists won't tell you unless you ask. Number 4, if you're on Medicare, a new Medicare GLP-1 Bridge program starting July 2026 will offer eligible enrollees access to weight loss medications for a $50 monthly copay. If you qualify, that's a game changer. The bottom line is this: 2 Americans can walk into the same pharmacy, hand over the same prescription bottle, and walk out having paid completely different amounts. Not because of anything related to their health, but because of an administrative code most of them never even knew existed. The system isn't going to explain this to you. So now you know. Talk to your doctor. Ask about the code. Appeal the denial. Use the savings programs. If this video helped you, share it with someone who's been hit with a brutal GLP-1 bill, because they probably don't know any of this either. And subscribe for more breakdowns of the healthcare stuff that actually affects your life and your wallet.